So Victoria Macdonald and Devi Sridhar, we're going to talk about 3 years on from the COVID lockdowns. What are you going to tell me?
I'm going to be talking about the WhatsApp messages from the then Health Secretary Matt Hancock, which have been leaked by the Daily Telegraph through the journalist Isabel Oakeshott. Now, we will talk about why she did that. She is anti-lockdown, but also having a look at whether Matt Hancock is right when he says that they were partial, a biased account to suit an anti-lockdown agenda. Did we learn anything? We learnt some things, but will it change our perception of the way the government dealt with COVID and lockdown? I don't think so.
Today I'm going to talk about the pandemic, the past few years in Britain, the WhatsApp leaks of messages, what it tells us about lockdowns, and looking ahead, how can we do better for the next pandemic in terms of our response?
Victoria Macdonald, I guess I want to start by talking about 3 years on from the pandemic. Right now, you've been reporting on the wave of strikes we've seen from nurses, ambulance drivers, junior doctors. There are now, as we speak, some talk of tentative agreements, deals, votes happening, a potential end to all of this. But when you go out and interview those individuals striking, how often does the pandemic, clap for carers, come up?
Actually, it comes up surprisingly often, and the reason that they want to talk about it is twofold. One is that many of them will say they never really truly appreciated that clapping. They didn't understand what it was for. They would rather have had more PPE or more testing. And now, of course, it comes up because they see it as deeply hypocritical. Oh, yes, you thought we were wonderful then, but you don't think we're wonderful enough to give us a pay rise. So, yes, a lot.
When we look at the tranche of WhatsApp messages that have been released, Matt Hancock's WhatsApp messages, by the journalist Isabel Oakeshott. She gave these to the Telegraph recently. She was given access to them because she was helping to write his memoir. And there are a series of messages which show his conversations with ministers, officials, and they give us an insight into the workings of government during the pandemic. What do you make about the fact that she did release these? She did leak them, and her stated reason for doing so, because she is a lockdown skeptic.
Well, I think that's the first point, isn't it? That she is a lockdown skeptic. She said it was to do a public service. I'm not completely convinced by that, and I'll tell you what the problem with these is. It reminds me very much of a brief period when I was political correspondent, and it was during the expenses scandal, and the Telegraph also had those leaks. And we were given them selectively, and we were given them sometimes out of context. And I think the problem with these WhatsApp messages is, and I agree with the former Health Secretary Matt Hancock, is I think sometimes they were taken in isolation. We weren't given a full picture of what was going on, and it was done because, and Isabel Oakeshott has never made any secret of the fact that she was anti-lockdown.
You still think there are some things we might be able to learn from them, even though, as you say, they are selective. The series of WhatsApps we got about testing in care homes, can you just remind me what they said and whether that revealed anything to you?
Well, it was interesting because the testing in care homes is one of the things that personally I still feel really upset by, because so many people died and there was a lot around at the time about what was going on in those care homes. It wasn't transparent. Now, it says in one message dated the 14th of April, Mr Hancock reportedly told aides that Sir Chris Whitty, the Chief Medical Officer for England, had conducted an evidence review and recommended testing of all going into care homes and segregation while awaiting the results. Now, that was interesting that we had that. There was a lot around at the time that was saying that should happen anyway. He said, Mr Hancock said, the advice represented a good positive step, and then we must put that into the doc. I think this was a document that was going to be published the following day. An aide responded that he'd sent the request to action. But later the same day, Mr Hancock messaged again saying he would rather leave it out, a commitment to test everyone entering these care homes from the community. Just commit, he writes in his WhatsApp, to test and isolate all going into care from hospital. I do not think the community commitment adds anything, and it muddies the waters. Now, the whole point about that is that it's not about muddying the waters. It's about the fact that there weren't enough tests to go around. So in some ways he was right, and his recent justification for those WhatsApps was that there just wasn't the testing available. But what it does show is that there was a lack of transparency again in government to what we, the journalists, were asking about why this was happening in care homes. And we know that even though there was testing on patients coming from hospitals, that didn't even happen properly.
Is that sort of in the main how you feel about a lot of these WhatsApp messages, that they offer some small insights here and there, but they're not groundbreaking?
I didn't come away thinking, oh my God, I absolutely did not know that. Even if it had not been confirmed, it was always swirling around in the ether and you had a suspicion. But I don't think in the way these WhatsApp messages have been released, actually we do learn anything massive from them. I mean, the one thing I suppose you see is, again, some hypocrisy in the way the Matt Hancock's memoir, which was ghosted by Isabel Oakeshott, presented one picture in which Matt Hancock was completely in charge and everything was great. And on the other hand, where actually during this period of an unprecedented period in our history, everybody in some ways was scrabbling to do what needed to be done to try and prevent the pandemic from spreading, or try and prevent the infections from spreading further and from people dying.
Now, 3 years on from announcing the first lockdown, those pandemic days still haunt Boris Johnson. This Wednesday, the former Prime Minister appeared in front of the Privileges Committee about his statements to Parliament over parties at Downing Street. Having sworn on the Bible to tell the truth, he accepted having misled Parliament, but said that he did not do so intentionally or recklessly. In a session lasting over 3 hours, Boris Johnson said that any gatherings were essential to the work of Number 10.
And people ask, why was this happening? Why was it necessary? It was necessary because two senior members of staff, the effective chief of staff and the director of communications, had both left the building or were about to leave the building in pretty acrimonious circumstances, or what were potentially acrimonious circumstances. It was important for me to be there and to give reassurance.
Harriet Harman, the chair of the Privileges Committee, accused Johnson of relying on flimsy advice to make those important statements to Parliament. Mr. Johnson said he hoped the committee would see what was in his heart and mind at the time. His allies have also accused the committee of being a kangaroo court. But if he's found by MPs to have deliberately or recklessly misled Parliament, he could face being suspended as an MP, which in turn would prompt a by-election in his constituency of Uxbridge and South Ruislip. This week we've seen Boris Johnson in front of the Privileges Committee about whether he intentionally misled Parliament about parties in Downing Street. In the WhatsApp messages, we see the allegation that Matt Hancock withheld the existence of their knowledge about the Kent variant just before Christmas in 2020, and timed when they'd actually tell everyone to sort of frighten individuals to following the rules. What did you think of that when you read that?
It's a strange combination, isn't it? Because on the one hand, we have a lot of public anger over the allegations against the former Prime Minister and about the fact that many people actually were following the lockdown rules. And at the same time, you have these WhatsApp messages when you could see the numbers were rising. I mean, I myself went to Kent to do a piece because it wasn't clear what was going on about why Kent had such a huge rise in numbers. Now, what I don't know and what you can't tell from these WhatsApp messages is how long they had that knowledge that there was a new variant. And there is a whole lot going back and forth in which they're talking about when to deploy the announcement about the new variant. Now, that really does make me feel queasy, because did they sit on it until it suited them, or did they get it out there as soon as the magnificent people doing the genomics analysis had told them, we have this new variant? I mean, I don't know, because these WhatsApps don't go further to tell us, and that's the problem with the whole of them. but you have to say that you would hope that they did the right thing.
Does it also show, given how the leak came about, that even though it's 3 years on now, it feels, especially in some quarters, that it's just as political and partisan and, almost become part of some sort of culture war, how you look back and reflect on this pandemic?
Well, I agree. But let's not forget that the COVID inquiry has started, and there will be a lot of people scrambling to protect their reputations and to try and rewrite history. And a lot of people have thought that the release of the memoir, of Matt Hancock's memoir, was precisely for that reason, to position himself as the nation's saviour, because they want to get it in there before the COVID-19 inquiry, which will go on for quite a long time, I suspect, actually reports.
Victoria Macdonald, thank you very much.
Thank you.
Devi, Sridhar, I guess I want to start by talking about Boris Johnson appearing in front of the Privileges Committee. Do you think that Partygate and the ongoing discussion of it is useful at all in learning lessons from COVID 3 years on? Or do you think that it's a story that maybe has dragged on a little bit too long?
Well, I think the important part of it is that most people were expected to make considerable sacrifices for the good of all, for their communities and for the country. And it was asked of us by our leadership and by our politicians. And so I think there is a certain level of accountability that those who asked all of us to sacrifice, not see our family members, not have to shut down businesses, not have kids go to school, are also the ones that need to take responsibility if they weren't living those principles in their lives for a very short period of time. So yeah, for me, it does matter, because I think if you talk to almost everyone, there was something they gave up for the good of all. And if our leadership wasn't doing it, I think that's quite disappointing.
Obviously, Boris Johnson, denies that he knew about a lot of the parties, that he was misinformed, that he didn't attend most of them. But when you look at Partygate and you look at the Matt Hancock WhatsApp messages, is the point here that it's really about the way politicians communicate with the public and the messaging that's involved when it comes to something like a pandemic? Because I believe that's something which I guess you would argue through your book and your own work advising the Scottish government, that Nicola Sturgeon was perhaps a better communicator than the government down in Westminster.
Yeah, clear messaging is vital, but also trusted messaging to understand what is happening, why, what is the risk, and what am I being expected to do in the next couple of weeks or months. And all of us were expected to do a lot in response to COVID-19 to change our lives in a considerable way. So that clear messaging over why are we doing this and when it will end, what are the next steps, I think was absolutely vital. And unfortunately, I think because of things like Partygate and the lack of trust in government, we don't have a lot of, people are a bit confused about what happened, why, was it intentional, were they being honest? And that's dangerous if we have future crises, because you need people to have a source of information that they trust, especially given all the various misinformation circulating online.
What would you say was one of the bigger mistakes you made, or perhaps something you learned during the pandemic?
I think one thing I learned was that the virus was always a couple steps ahead of us and the game constantly changed. And so the wild type is almost a completely different virus to Omicron. To give you an example, the wild type was expected to infect 2 to 3 people, initially even 1 to 2. And now Omicron, the more transmissible strains, it's 18 to 20. And that means that at every stage, we had to be wondering what happens next with the evolution of this virus and how do we adapt our policy responses, where that early on just didn't occur to me. It was, we had a virus. I hoped it would stay the same. We developed a vaccine against that strain, and that it constantly evolved, made it very difficult in giving advice and in constantly shifting what you were saying based on what was emerging with the virus, and whether it was Delta when it got more severe or Omicron when it became slightly milder, but still incredibly transmissible, which meant it became harder and harder to contain, control, delay infections as time went on.
And regarding the WhatsApp messages of Matt Hancock that have been leaked in recent weeks, Isabel Oakeshott, the journalist who leaked them, said that her motive in doing so was to question lockdowns and whether they should have taken place. She said, "We were all let down by the response to the pandemic and repeated unnecessary lockdowns. Anyone who questioned an approach we now know was fatally flawed was utterly vilified. It is now essential that the public inquiry set up almost 2 years ago quickly establishes deadlines for its work and answers the urgent question about whether lockdown, with all its impacts, was proportionate. What do you make of that?
Actually, I think what it reveals is how the government was quite late on things and often in circles about things, and how they didn't want to sometimes act quick enough and not looking at other countries. South Korea never had a national lockdown, but they contained the virus through testing. You can try to talk about Sweden, but Sweden has a completely different population profile, low obesity, low rate of chronic disease, 40% of people who live by themselves, which means you don't have household transmission, and a strong social security net, meaning people can stay off work and get sick pay and aren't forced in if they're infectious, which means you don't need to shut down sectors where people have to go in, otherwise they won't earn. And so I think it's a really interesting way they're trying to kind of rewrite history. Because if anything, if you look at public polls, people think not enough was done early on to protect people, that our death rates are way too high.
If Isabel Oakeshott is saying that lockdown wasn't the right thing, there isn't an example of what she would have done otherwise.
Exactly. And I think that's why I've constantly tried to look at who did what and what worked. And what worked was looking at South Korea, Japan, Denmark, and the things they did were testing, very quick, some places who could, border measures around testing, good messaging to the public on how to avoid the virus. In the case of East Asia, Japan, for example, masks were very effective at getting take up for indoor settings. So I think that's the real question, is why are we not looking at places that did find a way through this with keeping their economy largely open and keeping COVID rates so low?
Lockdowns aren't science, are they? It's a public health measure which goes back centuries, quarantine. It's a last resort for most countries, isn't it? It's waiting for the science. And while you wait for the science, you have to lock down.
Well, all lockdowns is that you isolate people and you treat everyone like they're infectious, right? So everyone is potentially at risk. And that's why at the start, because we didn't have testing, everyone could have been infectious. And that was that. Okay, we got to freeze everything and slow down transmission. And that's why I think coming back to testing, the countries like Japan, South Korea, and Germany even got their testing up and going really early, because they realized if they could test people, they would know who's infectious, and only they would have to isolate. And everyone else, if you tested negative, could go to work, could go into nightclubs, could go into restaurants. And so that was why we ended up in lockdown, because we couldn't find a good way to figure out who was infectious. Therefore, we couldn't slow transmission. And then hospitals started to become overwhelmed. We had a very scary first wave for hospitals, no adequate PPE for doctors dying in the front line of service. And that's what it was, a knee-jerk response because of the lack of preparation done.
Lockdown was clearly necessary, but do you have regrets about the fact that the UK or any countries had to do it, especially now as we see a lot of perhaps unforeseen consequences of what three lockdowns have done to the society?
Of course. And I think a lot of thought, I did think a lot. If you look back at my writing in March, I was saying, can we find a middle way? So can we keep, most things running, but shut down big gatherings, test at borders, because we know the first cases are going to be imported, get your mass testing in place, because that's what other countries were doing without a full scale lockdown. And I'm an international kind of researcher. So we were looking a lot at other countries and saying, well, what are they doing? And so it's quite hard, because I guess I often get painted as kind of pro-lockdown. But if you look at my writing from the start, it was always about what is the other path. I was not for letting it just spread. And the problem was our discussions became let it spread or lockdown, where there were other ways to suppress this virus using other kinds of, we call precise public health, scientific tools in public health. And so, I remember one of the first articles I wrote for The Guardian in 2020 was on my mind, because I do work with Save the Children in Scotland, and they go into difficult circumstances, all the kids who would be beaten up at home, they're not going into school. But on the flip side, if you don't have a way to protect teachers and school staff and cleaners in that environment, and they're going home to vulnerable families or themselves vulnerable, how do you convince unions it's safe to go to work in schools? And that was a difficulty that we can all agree lockdown is bad, but what are the solutions? And how do you make sure the people who need to work in these settings felt protective, felt safe, didn't feel at risk, had adequate PPE, had adequate ventilation, had the right spaces? And I wish that would have been our debates rather than, is lockdown good or bad? Of course it's bad.
Now, in the early months of the pandemic, as we waited for clear evidence, the most common assumption was that the virus emerged from the Hunan meat market in Wuhan.
It's believed the virus was most likely transmitted from animal produce at the market.
Yeah, there was initial speculation about it being a lab leak in Wuhan, but following a joint WHO and China investigation in 2021, they concluded that a lab leak was extremely unlikely. But that report was criticised for not being forensic enough, and for China not providing full access to the data. That helped fuel theories, a lot of them conspiracies about an intentional lab leak. But in recent weeks, the idea of an accidental lab leak has come to the fore. At the start of March, the head of the FBI said his organisation believed a leak from a Chinese government-controlled lab was the most likely scenario.
The FBI has for quite some time now assessed that the origins of the pandemic are most likely a potential lab incident in Wuhan.
And the White House itself has said there's no consensus across the US federal government about the precise origins. Yet, this week, a report was published that claims that animals, including raccoon dogs, which are susceptible to COVID, were present in Wuhan's Hunan wet market and may have been infected with the virus. And it used data that was briefly uploaded by Chinese scientists during the early stages of the pandemic. And so, this is still a very debated topic regarding COVID-19, 3 years on from when it all started. Something that we've seen recently, which is that more and more institutions, especially some federal institutions in America, are claiming that the origins of COVID could have been a lab leak in China. What do you think of that? Because I read in an article recently, you said, you're leaning more towards the lab leak, but you thought you might get in trouble for sort of saying that.
I think we just don't know. And the Chinese government have been incredibly cagey about sharing any information. There's been, I guess, recent evidence that some researchers say link it to raccoon dogs at the wet market, and possibly maybe we found this. The data has not really been shared transparently, so we can't really evaluate it. So I just go back to kind of first principles as a scientist, which is what are the hypotheses? What data do we have to support each? And are any conclusive? And right now, I don't think anything is conclusive. And so I guess the point I was trying to make is that conspiracy theories have kind of run around with this theory of lab leaks. But just because they're running with it doesn't mean that it's not true to some extent. We have to, as scientists, not just say, oh, we discount that, we discount that. We have to put all of the hypotheses on the table, evaluate them. And right now, I think the jury's out. We just don't know.
Does that cause you concern? Because I often think that, it was very much in those early those early weeks and months that, that lab leak theory was a conspiracy. It was something which was pushed by sort of Trumpian type figures. The fact that it's now moving back to a realm of uncertainty, is that worrying for, again, the trust in experts, the trust in the media, the trust in scientists?
Well, I think if you talk to, at least most of my colleagues at the start were saying it could be. I think potentially because Trump went so extreme at some point saying, this was created by the Chinese, which I don't think they did. I don't think any country wants to be responsible for what happened, which is why we're seeing such lack of transparency by the Chinese government. I do think they're responsible for a lot of delays at the start and getting information out and, making it more and more difficult to stop the virus getting into lots of other places. But I think actually, if you talk to most of my colleagues, the jury was out, and it still is out on what has happened.
Isn't the common thread in everything we've spoken about here, really, it's about politics, right? Because pandemics don't happen in vacuums. They happen with all this political chat, messaging, communication going on. The fact that we're talking about a lab leak comes from, perhaps arguably comes from a much more confrontational Washington towards Beijing. The WhatsApps, the Johnson inquiry, it's all about the politics around it.
It's very tricky, yeah, because I don't think you can escape the politics, because you often get told as a scientist, oh, be scientific, don't be political. But when it comes to things like, do you prioritize life? Do you prioritize human health? What are the choices society makes over, where it puts its resources, the functioning of the NHS and the NHS workers within it? It inevitably goes into politics. Public health is about the choices we make as a society, and that in the end is politics and resources and priorities. And so that's a tricky thing, which is saying, yeah, you stay in your lane, but I'm like, well, that lane actually covers and unfortunately intersects with a lot of political things, which we have to be willing to get into, because otherwise we're not going to be able to make the steps to improve public health, whether in Britain or anywhere else.
Devi, Sridhar, thank you very much for talking to me. Thank you.
Thank you.